All right, if you're getting ready for your state board exam, you know there are some topics that are guaranteed to show up. Well, today we're tackling one of those head-on, hot and cold applications. By the time we're done here, you are going to have all the key points you need to absolutely nail any question they throw at you.
So let's focus on what the exam is really testing you on. We're not just going to cover the what, we're going to dive deep into the why. We're talking about the science behind how they work, the major dangers you have to prevent, which patients need extra special attention, and of course, the absolute, non-negotiable safety rules that will keep your patients safe and get you that passing grade.
First up, let's talk about heat therapy. To use this safely, you've got to understand what's actually happening inside the body, and it all starts with your blood vessels.
Okay, here's a key term you're definitely going to see: vasodilation. It's a fancy way of saying that when you apply heat, the blood vessels in that area get wider. Now, why does that matter? Because it allows more blood to rush into that area. Think of it like opening up all the lanes on a highway to get traffic flowing.
So why do we want all that extra blood flow? Well, more blood means more oxygen and more nutrients getting delivered to that spot. And that's exactly what helps to relieve muscle pain, reduce that chronic, achy joint pain, and really speed up tissue healing. Simply put, more blood flow equals more healing power.
But, and this is a huge but for the exam, with this benefit comes a very serious risk. The single biggest danger of heat therapy is burns. As a professional, your #1 job is to prevent this from ever happening. Period.
All right, now let's flip the coin and look at the other side. Cold therapy. This works in the exact opposite way of heat, and understanding that difference is absolutely crucial for the test.
Your must-know exam term here is vasoconstriction. If vasodilation was opening up the highway, vasoconstriction is like shutting it down to a single lane. Applying cold makes the blood vessels clamp down and get narrower, which, you guessed it, reduces blood flow to that area.
So why on earth would you want to reduce blood flow? Well, think about a fresh injury, like a sprained ankle. Reducing blood flow is fantastic for controlling that initial swelling and pain. It also helps to numb the area, giving some immediate relief, and it can even slow down or stop bleeding by tightening up those vessels.
And just like heat, cold therapy comes with its own big risk. The critical danger you have to prevent here is frostbite. That's when the skin and the tissue underneath actually freeze, causing some really serious damage. Think of this slide as your ultimate exam cheat sheet. It lays everything out side by side. Heat, vasodilation, more blood flow, risk of burns. Cold, vasoconstriction, less blood flow, risk of frostbite. If you can memorize this chart, you are in fantastic shape for the exam.
Okay, knowing the science is one thing, but the exam is going to make sure you can apply that knowledge safely. That means being able to identify the patients who are at the highest risk for injury from hot or cold therapy.
And let's be perfectly clear. This isn't just about passing a test. This is about patient safety. For the people we're about to discuss, a small mistake can lead to a severe injury. Your attention to detail is what protects them.
So who are these high-risk groups? First, older adults, because their skin is often thinner and more fragile. Next, anyone with sensory issues, maybe from dementia or nerve damage, who can't feel or tell you that something is too hot or too cold. Also, people with poor circulation, like many diabetics. And finally, anyone with metal implants. Metal conducts temperature really well and can cause deep tissue burns.
We have now arrived at the single most important part of this entire presentation. This is critical for your exam and for your entire career. These are the 5 absolute safety rules you must follow every single time, with no exceptions.
Let's run through them. 1. Always use a protective barrier. Never, ever put a pack directly on the skin. 2. Follow the time limit. 3. Check the skin often. 4. Only apply it if it's part of the official care plan. And 5. Report any problems immediately and document everything. Now, let's zoom in on 2 specific numbers from this list that you have to know.
Here is the first number to burn into your memory: 5 minutes. After you apply a pack, you need to check the patient's skin every 5 minutes for any signs of trouble, like excessive redness, pale skin, or blisters. Every 5 minutes, no exceptions. And here is the second number you have to remember: 15 to 20 minutes. That is the maximum amount of time a pack should be left on. Any longer, and the risk of tissue damage goes way, way up. Set a timer and be precise.
If you forget everything else, remember this:
These are the 3 most critical, life-saving, and testable actions you can take. Use a barrier, check the skin every 5 minutes, and remove the pack after 15 to 20 minutes. That is the core of safe practice.
Ultimately, this information isn't just for an exam. It's about a fundamental responsibility you have as a healthcare professional. Your knowledge and your actions are the line between therapy and injury. The patient's safety is, quite literally, in your hands. So the only question left is, are you ready to protect them?